Skip one Medicare part and you can lose access to 3 others, plus a penalty you pay every month for the rest of your life. So you sign up for Part A when you turn 65. It was free. You skip Part B because your employer still covered you. Made sense at the time. Then you retire 2 years later. You wanted drug coverage. You looked up Part D and you found out Part D requires Part A or Part B. You had Part A, so the door opened for you. But your neighbor, who skipped both parts when she turned 65, locked out. No drug coverage, no Medicare Advantage, and a penalty that follows her for the rest of her life on Medicare. So most people do not know the 4 parts of Medicare depend on each other. They are not a menu you pick from. They are a chain. And if you break the chain, some doors close permanently. And here's how the dependency system actually works. In episode 1, we covered the 4 parts. A is hospital. B is medical. D is drugs. And C is a Medicare Advantage. Now, if you've not watched that one, go back and watch it first. Everything in this episode built on it. The mistake most people make right after learning the 4 parts is assuming they can pick and choose freely. Part A sounds good. Part D sounds useful, but if you skip Part B because it costs $202.90 a month and you already have employer coverage, well, that seems logical, but it's also where the problems start. Medicare is not a buffet where you grab what looks good and skip what you don't want. It's a building with locked floors. Part A is a ground floor. Everyone gets in. Part B is the elevator. Without the elevator, the upper floors do not exist for you. Here are the actual dependency rules. Part D, your prescription drug coverage, requires you to have Part A or Part B. You need at least one of them before Medicare will let you enroll in a drug plan. That includes standalone prescription drug plans and any Medicare Advantage plan that bundles drug coverage. No Part A and no Part B means no Part D. Not Part D costs more without them, not that Part D has more restrictions. No Part D at all. The door does not open. Part C Medicare Advantage is even stricter. Part C requires both Part A and Part B, not one or the other, both. You cannot join a Medicare Advantage plan with only Part A. You cannot join with only Part B. You need both keys to open that door. This means every single person on a Medicare Advantage plan is paying the Part B premium. Every one of them. So that $202.90 a month that we talked about in episode 1 is not optional if you want the Medicare Advantage path. It is a price of entry. So now think about what this means if you are still working at 65. Your employer covers you. You sign up for Part A because it's free. You delay Part B because you do not want to pay $202.90 a month while your employer plan is handling everything. That's allowed. Medicare gives you a special enrollment period to sign up for Part B later when your employer coverage ends. So no penalty for the delay. No gap in the eligibility. But during that entire delay, while you only have Part A, 2 doors are closed to you. The Medicare Advantage door is closed because you do not have Part B. Every plan in your state, every HMO, every PPO, every zero premium plan with dental and vision and hearing included, none of them will accept you until you hold both keys. And every standalone drug plan is available to you only because you have Part A. And if you skip Part A, you would have nothing. No drug plan, no Advantage plan. no path into Medicare at all until you enroll. The dependency is absolute. It does not care about your situation. It does not care about your employer plan. It only checks whether you hold the keys. Now, there's a second dependency most people miss entirely. This one is not about getting in. It's about what happens when you switch paths. In episode 1, we explained the two paths, Original Medicare or Medicare Advantage. Most people hear that and think Part C is something that you add on top of your Original Medicare. Well, one more option in the stack, one more layer of coverage. It is not. You do not add Part C on top of your Original Medicare. Part C replaces how you receive your benefits. You keep your Medicare card, but you also get a new card from the private insurance company. That plan card is what you use for care. Same program name, different system entirely. When you join Medicare Advantage, that private company receives a monthly payment from your Medicare to cover your care. They take over. They decide which doctors are in network. They decide which drugs are on the approved list, what Medicare calls the formulary. They set the rules for referrals, prior authorization, and out-of-pocket limits. Your Part A and Part B benefits still exist on paper, but you access them through the private plan's rules, not through the government directly. This is where the plan types come in. Inside Medicare Advantage, there are different structures. HMO plans require you to stay in network and get referrals. PPO plans let you go out of network but charge you more for it. Private fee-for-service plans let you see any provider who accepts a plan's terms. Each type sits inside Part C, and Part C sits on top of Part A and Part B. So if you remove either foundation piece and the whole structure collapse. Now, here's a part that changes how you think about switching. Say you spent 3 years on a Medicare Advantage plan. Your favorite specialist leaves the network. You want to go back to Original Medicare. You can switch. Medicare lets you change path during open enrollment every year. But here's what Medicare does not tell you on the enrollment form. When you come back to Original Medicare, you will probably want a Medigap policy to fill the gaps. Original Medicare has no out-of-pocket maximum. It does not cover dental, vision, or hearing. Medigap fills those holes. But Medigap companies in most states are allowed to ask about your health when you apply. Your federal Medigap open enrollment window is a 6-month period that starts when you are 65 or older and enrolled in Part B. Once that 6 months passes, it does not come back. It does not matter whether you were on Original Medicare or Medicare Advantage during that time. The clock ran out. Now, the insurance company can look at your medical history. They can charge you more based on pre-existing conditions. They can deny you entirely. So the dependency chain is not just about getting into Medicare. It's about what happens when the timing windows close. If your Medigap open enrollment passed while you were on Medicare Advantage, you may not be able to get a Medigap policy on the same terms when you come back to Original Medicare. You may not get Medigap coverage at all. So every move in Medicare triggers a dependency somewhere else. And the system does not warn you before you make the move. It warns you after. So there is one more lock in this chain. It is the one nobody sees until it costs them real money every single month. It is called the late enrollment penalty. It is permanent. If you were eligible for Part B and did not sign up when you were first eligible, and you did not have a qualifying employer coverage during that gap, Medicare adds a penalty to your premium. The Part B penalty is 10% of the standard premium for every full 12-month period that you could have had Part B but did not. So let me make that concrete. You turn 65. You do not have employer coverage. You skip Part B because you feel healthy and do not want to pay $202.90 a month. 2 years go by. You change your mind. You sign up for Part B during the general enrollment period. Medicare looks at those 2 years, 2 full 12-month periods without Part B and without qualifying coverage. That's a 20% penalty. 20% of $202.90 is about $41. So your Part B premium is now $243 a month, not for a year, not until you catch up, every single month for the rest of your life on Medicare. You will never pay the standard $202.90 again. You will always pay $243. And if you waited 3 years, it would be 30%. $202.90 becomes $264 a month forever. And here are the numbers. You may want to save this video so you can come back to them. 1 year gap, 10% penalty, about $20 added to your monthly premium forever. 2 year gap, 20%, about $41 a month forever. 3 year gap, 30%, about $61 forever. Part D has its own penalty. 1% of the national base beneficiary premium for every full month that you went without drug coverage that Medicare considers real coverage, what they call credible coverage. In 2026, the base premium is about $39 a month. Skip drug coverage for 24 months, that's roughly $9 added to your Part D premium every month, permanently. Over 10 years, that's $9 a month adds up to more like thousands of dollars. For a decision that you made in one afternoon, the penalties are not fines. They are not one-time charges that you can pay off. They are monthly surcharges that compound over retirement lifetime. So 20 years of a $41 Part B penalty is nearly $10,000. For skipping Part B for 2 years, well, this is where the dependency chain becomes a financial chain. Skip Part B, lose access to Part C, limit your Part D option, get Part B late, pay the penalty on every premium check for life. One decision, one gap in the chain. A permanent cost that never stops compounding. The system is not designed to punish you. It's designed to keep everyone in the insurance pool. But the consequence for stepping out of the pool, even briefly, is a surcharge that follows you to the last premium payment. So here's what I want you to take from this episode. The 4 parts of Medicare are not 4 independent choices. They are connected by dependency rules that most people do not learn until they break one. Part D needs Part A or B to open. Part C needs both A and B. Part C replaces A and B, and it does not stack on top. If you delay or skip a part where you were eligible for without qualifying coverage, the penalty follows you for life. The $202.90 a month Part B premium is not just a bill. It's the key that unlocks drug coverage, Medicare Advantage, and your ability to move between paths without losing Medigap access. You skip it, the doors close. Some of them do not reopen on the same terms. So the next episode, we cover enrollment windows. When you can sign up, when you cannot. The enrollment windows and coverage rules that determine whether you pay the standard premium or the penalty premium for the rest of your life. So that's the episode where the calendar becomes your most important document. So go to Medicare.gov or call the 1-800-Medicare. Ask one question. Do I have all the parts I need for the path I want? If you are delaying Part B because of employer coverage, well, ask them to confirm your coverage qualifies for the special enrollment period. Get it in writing. Do not assume. The penalty for being wrong does not expire. Now, if you delay Part B or skip drug coverage, tell me what happened. Were you hit with a penalty? Or did you get lucky with a special enrollment period? Share your experience in the comments. If someone you know is approaching 65, send them this video. The penalty for not knowing this does not expire. So if you're finding this series useful, subscribe. The next episode is Enrollment Windows, the calendar that controls everything. I'll see you in the next one. I'm Han Brown, and this is The Han Brown Show.